I'm in.
Hello.
Hi,
You
Crystal. How
are
are you doing?
in. Hi, I'm good. Thank you. How are you? How are you this Sunday?
Not too bad. Not too bad.
Yeah.
Your good weekend?
Yeah, not bad, not bad. So, Joash, I just wanted to say, I know you've been incredibly busy on call, and even on your day off yesterday, you were busy attending medical conference webinars from home. The very
Yes.
hardworking person that you are and very dedicated doctor that you are. So, it's a real privilege. It's a real privilege to have you join me and the rest of our viewers today to share with us some of your experiences working with COVID-19 patients and
Mm,
working in a COVID-19 ward. So yeah, and I just want to say that, you guys in healthcare have become our real heroes. And, while a lot of us are, the rest of us are staying at home and trying to do
mm.
our part, you guys are out there, risking your lives to save others. So I think I speak on behalf of others when we say thank you very much to all of the frontliners, the doctors, the nurses, the pharmacists, and everyone
Mm.
out there, taking care of the rest of us at home.
It's very gracious of you and very kind of very, very kind words. I think, yes, everybody has been working hard. Everybody has been pulling through, pulling together. I cannot be we cannot take credit alone. I mean, healthcare as a healthcare, we work together as a team. We work together as a family, and everybody top down, from the people who are the directors, the director general who has been giving updates, live updates every single day, all the way down to the people on the grassroots, the ones going out into the fields, going out into communities, reaching out to those people with who potentially may be infected, taking swabs, the people who are keeping us clean in our hospital environment. I think the credit goes to all of them. And I think a lot of times we forget that. We just look at healthcare workers. Yeah, they're the frontliners. They are the ones that have been working hard. But the truth is here. So I think this war can only be won if everybody knows their role. And we are not alone. You guys staying at home itself is part of the game, is part of the plan to help us to win this war together. So thank you too. It is not easy. I cannot imagine the hard work that people are putting in to stay home, to still continue to make ends meet, the amount of businesses that people have lost in this period of time. It must have been very hard for a lot of people. Jobs are lost, incomes going down. So I think for us in healthcare, we, at least in Malaysia, I speak for the Malaysian perspective, is that at least we still have a chance to work. We still have a steady income. We don't have to worry about food on the table for now. And we hope that never has to change. So our hearts and our prayers are for those people who have not been as fortunate as us, truly.
Yeah, thank you. Thank you for sharing in everyone's sentiments. And, I like what you said, that COVID-19 is not a battle won just by the doctors and nurses and the frontliners, but it's a war that's really fought on many, many more fronts. Tell us more.
This is, I mean, when we talk about warfare, right, this is a war that is where our enemy is unseen. We don't see this. And I know a lot of people have said this over and over, but if you look at it from a very literal perspective, everybody has a different role to play. So healthcare is obvious because we are always in the front line. We are the ones wearing the PPE. We get the most amount of attention. But even in healthcare itself, there are people that you do not see. Apart from the nurses, the doctors, my medical assistants who are out there collecting samples in their full PPE, dressed up in the wards, these are the cavalries. We are the cavalries, right? The ones who are the front line, the ones that are going to go out and find the samples and find the positive patients, bring them back to the hospital and look after them. What people do not see are my lab technicians, the ones who are sitting in the laboratories, running the tests day in, day out. We do not see the radiographers. They are the ones who are running x-rays, who are running CT scans for our patients who need investigations, radiological investigations urgently. We don't see our cleaning services. And our cleaner services have been the most amazing team in our whole hospital. They have been incredible. The amount of time that they spend, the number of times they have stopped me from going into a room just because they don't think the room is ready. It's like, doctor, jangan masuk. And then they go in, they quickly wipe down the door handles, they wipe down the surfaces. They are happy only to say, okay, doctor, sekarang you boleh masuk. And it's very heartwarming. There are so many services, and don't forget the people who are putting food on the table for our doctors, for our patients, right? The dietary services. And then when you step out of hospital, when you step out of healthcare services, you have the police, you have the army who are there to enforce the restricted movement order. And the restricted movement order is important, which I think we will be sharing a bit about why it's so important later on. But these are the people who are ensuring that in this time, the restricted movement order is in place, that people don't just wander out for this, for fun or for the sake of it, for trying their luck. And finally, the support mechanisms, our support teams, which have mostly been the Malaysians themselves, the citizens. I'm not sure how it is like in other countries, but I speak from my experience in Malaysia, is that we have had tremendous love, tremendous support, and tremendous help coming from the Malaysian citizens. In my time working in the COVID ward, the number of WhatsApp messages, the number of phone calls that we have received from complete strangers asking us, hey, I heard you're working in Teluk Intan. Do you need help? We heard that the situation in Teluk Intan is not great. What can we do to help? And even before I can specify what we need or what are the things that we need, the next day you see just boxes of masks, surgical masks there. You see people coming in, donating their hand-sewn protective equipments, their face shields. And this is kindness. This is support, and this is a lot of love. So this war, we could not have won it. I think we are winning this war. I won't go so far to say that we have won, but I think we are winning this war, and that is because everybody has been supportive. Everybody has done a tremendous amount of work for us and with us.
Thank you for sharing. You know, I really echo what you say. It's not just obviously the frontliners are out there risking their lives to save others, but it's also a whole army who are involved that we don't normally necessarily think of. You know, at the first instance, people like cleaners who ensure the cleanliness and the hygiene of doctors and nurses who treat patients and things like that. And really, on our part as society, we also help out by staying at home, by reducing the transmission and the spread of the virus so that we can help you guys who are working in the hospitals. Quite right. And you mentioned something to me before, which I found very interesting. You said that, you know, you've never felt more protected than you have in your career during this COVID pandemic. Tell us why you say that.
On many levels. Maybe let's start by sharing about from the very start when we first read about this. The context being that in December last year, we started to realize that hey, this is an emerging disease and it is gaining a lot of traction. They're gaining a lot of infectivity, gaining a lot of morbidity and mortality originating from China. And as it slowly started to make its way down, beginning with, as usual, naturally beginning with countries with very high volumes of travel, international travel, then we started to roll. And at the point of time, in our minds, we were already thinking, it's just a matter of time that it will come to our shores. And sure enough, it did. So at the very start of it, for myself and for a lot of my friends, there was a lot of anxiety, a lot of worry, in the sense that this was a new and an emerging disease, a new and emerging virus that we are not very experienced, we're not very familiar with. So no doubt, COVID is a substrain of a coronavirus, where in the past we have dealt with MERS-CoV, but then this is something new. We are seeing that people are getting infected very quickly. The numbers rise exponentially. And the initial theory, which is now found to be true, is that patients do not have to be symptomatic before they can transmit a virus. And for us, that was a concern, because how are we going to pick it up? How are we going to detect it? So as the virus started to come to our country, as we started to gear up, as we started to get ready to embrace our first patients for COVID, we started to make preparations. We started to have a game plan. Okay, in the event if we have to start accepting patients, where are they going to go into? In the event if our team has to start to look after COVID, what is the game plan? What's the strategy? Because if we are looking after COVID patients, chances are we will only be looking after them. We cannot be separating ourselves and looking after other cases. Remembering also that at a point of time, we were not very familiar with how infective is COVID. We know it's very infective, but if we say, let's say we wear 2 layers of gowns, we wear 3 layers of gowns, what's the chance that we will get exposed? And what are the chances that we will expose it to other patients? So there was a lot of focus on how to keep ourselves safe and how to keep our other patients safe. So eventually, as time go by, as we started to go through the national guidelines, as we started to read through the international experts' opinion and international guidelines, as we got better at it, we finally found our footing. We were better paced. We were better prepared to handle this. And not only was the support from society very good, the love and the care that was shown by society very good, but also top down. Every day there were instructions from the Director General updating us on, hey, these are the new evidences. Hey, there's a lot of things changing. Have a look at it. Please read it. Please be familiar. And pharmaceutical companies have done a tremendous amount of work too for us. They have been organizing webinars. They have been organizing CMEs online to help educate us, to bring key opinion leaders, experts in the field, to share their opinions with us on similar online platforms, maybe not on IG because it only stays for 24 hours, but on proper channels, on Zooms, on their webinars, on that. So there were a lot of seminars, a lot of teaching that was happening. And as we were looking after patients, we also spent a lot of time going through all these materials. So in the last 2 months, I dare to say, in the last 2 months, I have attended more webinars than I've attended conferences in my last 6 years working as a doctor. That is the amount of support.
I think you guys, have received sounds like you guys have received so much overwhelming love and support, not just, from the public, but also internally within the hospitals. And I think it's testament to the Director General of the Ministry of Health in Malaysia, how he handled and kind of led, right? It takes a good leader to lead a whole team of healthcare professionals in combating this virus that is kind of like a ghost, and as you said, rightly so, we don't see the symptoms, and that is why people go out unknowingly spreading it to others because they don't know they're infected with it. And I think that's why it's so dangerous. This virus is so dangerous because we can't see it.
The unseen enemy. Quite right, Chris. Quite right.
Yeah. So Joash, tell us what your typical day was like in the COVID ward treating COVID patients. Were there any life threatening kind of moments, that you guys had code? I don't know, in the hospitals, do you call it code or rapid response and things like that? Tell us more about what you experienced.
Okay, so starting with a typical day in COVID when I was still looking after COVID, our day starts with us first going to work and changing into our scrubs. And before we go in to see our patients, we start with a virtual rounds. We go through all our patients. We go through patient A all the way to patient Z. We get a passover from the night team. We ask them, okay, any concerns? How were they? Did they sleep well through the night? Were their vital signs stable? Were there any concerns that they raised? And they will feedback to us. They will tell us, patient so-and-so had some cough. Patient so-and-so had a fever, and we have given them this, etc., etc. So before we go into the room, we would already have a rough idea of what to gauge. Or what to do when we go inside the room. Because mind you, once we put down the PPE, once we enter the room, as much as possible, we are not going to go out, go in, go out, go in, go out. So we are going to go in sekali and we are going to settle everything as much as possible. The next thing that we do before we go in is that we phone call all our patients. So we pick up the phone, we call them and say, hey, I heard yesterday you had a fever. How are you feeling right now? Tell me more about this. So we get partly it's because we want to get an idea of what we're going to expect when we go in and see them, and to also tailor our examination to focus on their concerns, to help address their concerns and to administer the treatment that is required for them. So by that stage, as we go in, we would have already brought in whatever extra medication we needed, whatever extra tools that we may need to go and examine a patient. You'd be surprised. In a hospital like Teluk Intan, we don't have amazing resources. We don't have MRI machines. We don't have special blood tests that only can be done in the United States. We don't. But the truth is, the important thing with the management of COVID patients is the clinical examination. A lot of focus, as with so many other diseases, dengue, for example, pneumonias, for example, the key element of looking after this patient remains to be the clinical examination. Yes, blood tests are important. Yes, the X-rays, the CT scans are important. But the first step that tells us that a patient is deteriorating will be in the examination. And so
the examination is crucial.
You're right. So we go in, we examine them, we listen to them, we check their vitals once more, and then as we start to come out, we feedback to the team, we feedback to our specialists. Sometimes we speak to the team in Ipoh to get expert opinions from them, to get expert advice from them. So fortunately, coming to the second part of your question about whether have any of my patients coded during my time in COVID, fortunately no. But there were patients of ours who did deteriorate, who did require more attention. And what we did was that in patients of ours who required more attention, we spoke to Ipoh team and we actually sent them over to Ipoh. Now, Ipoh is an advanced hospital. It is a tertiary hospital. They have a brilliant team of intensivists who works in a very highly specialized ICU unit. We have in Teluk Intan, I have a very good ICU team. I have very brilliant anesthetists. Yeah. But in Ipoh, they have more facilities. They have more abilities to run tests. So we did end up sending a number of patients over to Ipoh for that reason. And the fortunate thing is that these patients have made good recovery. Thanks to the team, thanks to the good work done by Ipoh.
Yeah, okay. And you know, do you have any stories to share with us about doctors like yourself and nurses and frontliners working in the hospitals, right? Stories of, you know, where doctors and nurses sacrificing for the sake of their patients and to treat patients and to save lives, you know, acts of heroism, stories like that.
There were times where I think for a lot of my nurses, they actually, what they did was they sent their children back home to their in-laws, to their families, their husbands who were away, for concern that they would accidentally spread the virus to them. So on months on end, they would not see their children. So when they go on video chat, sometimes we see their children, you can hear them crying over the phone, and my nurses staying strong for them. It's like, you feel it for them. A lot of times, for myself, I also ended up spending 6 weeks away from my wife. We still stayed in the same house, but I ended up sleeping in that corner over there with a mattress away from my wife.
Jill is pregnant at the moment, right?
Yes, yeah, she's pregnant.
Congratulations on that, by the way.
Thank you, thank you. So yeah, that too. Went to work in separate cars. So I think separation was one of the big sacrifice. I also ended up not going back to Ipoh, seeing my parents for quite some time. So that's one of the things. I think other people have it worse than us. In like my colleagues in Sarawak, some of my colleagues in KL and Penang, they ended up staying in the hospital for a good 1 month on the stretch. So yeah, hard work.
Yeah. So I thank you so much, guys, to all the healthcare heroes out there. You know, I mean, like personal stories like yourself who have to, you know, sleep separately away from your wife in separate rooms, drive separate cars to work and things like that. It's so that you can continue treating patients without, you know, worrying so much. I mean, I guess there is still that worry, right? Whether you come home and potentially may carry the virus. And and I guess it's a sacrifice that doctors and nurses and frontliners and people who work in hospitals kind of have to carry with them. And I think I can only imagine
especially, and even before this period of COVID, there was always that risk that we may accidentally bring back bugs from the hospital, bacterial and viral infections. So with COVID, our worry was that, but we realized with experience and with time, we now realize that if we follow the proper guidelines, if we follow the proper personal protective equipment, the chances of that happening is actually quite slim. So we have learned from the evidence that is available. We have learned from the advices from other countries, and we have also learned from our own experiences. And fortunately, I can say that for myself, for my colleagues, for my team that have been looking after COVID patients, if we obey, if we follow the proper protocol, we will be safe. And we hope that remains the case.
So by following proper protocol, what steps or protocol do you all take to ensure your own safety?
Yeah, very good question. I think the first and foremost is the first thing that we do is we make sure that we are healthy. So it has happened before in a number of healthcare centers around the world, for example, and even in Malaysia, a number of healthcare centers happened where some of our colleagues actually were unwell. They came to work and other colleagues fell sick only for us to realize that, hey, could this be COVID? And in some cases, it turned out to be COVID. So that was how it may potentially spread among healthcare workers. So the first thing that now we institute is that we ask a simple question: are you healthy today? Are you well today? And if you have the telltale signs, if you have the fever, if you have the running, if you have the cough, if you have the difficulty in breathing, don't come to work. Seek treatment, get help. Don't work. Don't expose yourself unnecessarily, and don't expose other people unnecessarily. That's the first thing. And the second thing is that there are certain levels of protection that is required. It all depends on the setting that you're working at. So, for example, in a COVID ward, that is going to be the highest level of protection required because we are dealing with COVID patients. This is considered as a highly infectious setting. So the level of protection is going to be what you see on Facebook, where there's a face shield, there is a disposable hoodie, there is an N95 mask, there's that double layer of suit over with the boots and with the shoe cover with double layer of gloves. That is the among the highest level of protection. And even higher level, if let's say you realize that you have to do procedures to help stabilize a patient. For example, like in an event, if a patient coughs, they cannot breathe. You have to put a tube down their throat and you have to connect it to a ventilator, or you have to connect it to some breathing devices. That may require even higher, even more sophisticated levels of protection. For example, the space suit, the space helmet with the special rebreather mask. So that is even required. Whereas for the day-to-day settings in a clinic, if you're looking just at a normal patient who is relatively well on a follow-up, probably lower levels of protection required. To keep ourselves safe, and as a matter of fact, since you brought this up, not just to keep ourselves safe, but the practices that we should be adopting even before COVID period is a minimum level of hygiene. So by minimum level of hygiene, we're talking about hand washing. We are talking about a handkerchief in the pocket. When you sneeze, cover your nose. When you cough, cover your mouth. That proper hand hygiene. Basic levels of decency and courtesy. If you're not well, don't go out. Don't go to a large gathering. So those are the very basic things that we should be practicing even before COVID. But now with COVID, it becomes more apparent. Especially more. You're right.
Yeah. Okay. And then I guess we spoke about, I think you mentioned that the staff in your hospital, thankfully, no one has been infected. Am I right? Or, I don't know about other hospitals. What happens when staff are infected with the virus? Do they then go home? Do they get warded along with other patients as well?
So I think some of my staff members were actually infected, were infected by the virus, but they did. Fortunately, they did. I'm not sure if any of them are joining us today. If they are, hello. Okay. But they did get better. The way the virus transmits is, let's say, if you're in close contact. So if you're in close contact, if you're in close contact with a person who is positive, unknowingly you may just catch the virus. And that doesn't necessarily have to happen, when we are looking after a sick patient. It can also happen even among friends, even among colleagues without us knowing. So that could have happened. The question being, what happens if a person is infected? If we find out that a person is infected in Malaysia, the standards is as long as you test positive, regardless of how well you are or how sick you are, you go to a hospital. Period. End of story. And that has been a very good strategy in the Malaysian setting, because it means that in the event if a patient is infected, we catch him, we bring him to hospital, so that for two good reasons. Number one, we monitor his progress. We make sure that he recovers. We make sure that he's safe to go home. We make sure that he's negative before we let him go back home to his own home environment. But more importantly, number two is because that we want to make sure that this person doesn't accidentally spread it to people he live with. Now, remember that in Malaysia, our social demographics is very diverse. We come from a very diverse background. So we have people who live in large communities, large household communities. For example, one house easily housing up to 10, 20 people in some areas. And even if we try and quarantine, some of them just do not have the ability or the capacity to quarantine themselves. So the benefit being that if you cannot come to a hospital, the hospital comes to you. We send ambulances, we dispatch people to come and pick them up and bring them over to a hospital. So one of our successes in Malaysia, and I think all credit to good leadership and good ministerial direction, is that our healthcare service is robust. We have a very strong we have a very affordable, and we have a very accessible healthcare service. Literally, if you cannot come to us, we will come to you. And
That's
in
great.
places like Kuching, like middle of Perak, in the highlands, people have moved mountains to bring ill patients over to us. And it is incredible the work that people have done.
It's great to hear stories like that too. I think people feel comforted when they know, right, that that the country has these
Yep.
services in place to look after them. When,
We have your back. We have your back. That's the truth. That's the truth. Civil service.
Okay, I
That's
think
what
people-
civil service is all
people
about.
really
Yeah.
like listening to this. And you mentioned one of the strategies which medical teams have been taking to contain the virus, which is as soon as someone is tested positive, to admit them to hospital, which is
Yes.
great for two reasons. You mentioned the first reason being that they get medical attention as soon as possible, so that hopefully speeds up their recovery
Yes. Yes.
before it's too late, and secondly also to stop them from spreading the virus to other people. So what other strategies is the medical team in your hospital or in Malaysia generally taking to contain this virus?
Yep. So even let's answer this question from a very general approach. Even if, let's say, not even for COVID, but for many other diseases, first and foremost is the awareness, is the education. Now, the ministry has been very vocal about what are the things to look out for. So there was lots of posters, there are a lot of social banners, there are a lot of ads on Facebook coming out from ministry, from official sources about what are the signs and symptoms of COVID. If you have fever, if you have cough, if you have traveled anywhere and you have any of this, please come to us or speak to us, call the hotline. So numbers are always widely available. If you Google search it, it's there. So information has been made widely available. Education and awareness. So that is one key, because if good information does not come out from official sources, people are going to get information from unofficial, from unverified sources, and you never know if the information is good. So at least one thing good that the Ministry of Health Malaysia has taken is that good information has always been made available. And every day, 5 p.m., 6 p.m., Datuk Hisham is on live TV to address the nation, to address any questions that the media poses to him. And after that, following up, there's also written engagements that carries on through the day, which is amazing. First strategy.
Yeah.
The second strategy is the restricted movement order, which has been implemented in many countries, including in Malaysia. And in Malaysia, this is very important, this is very effective, because as Malaysians, we are very naughty. We are very cheeky.
In
Government
what way?
says, don't do this, we still end up doing it. Government says, don't speak, we still speak. so having enforcement makes a difference, because you do not want people to be gathering in large areas, gathering in big crowds. That expedites the spread of the viruses. And finally, the third strategy that we are now doing is that we are now doing the investigations. We are now bringing the tests down to the community levels. At one point of time, at the very start, we were telling people, okay, if you have illnesses, come over. If you have illnesses, come over, seek help, give us a phone call, we'll bring you to the hospital. And it has now started to evolve with time. It has now started to evolve as active hunting, active searching. And to this end, we credit the incredible, the state officers, the state directors, who have a very incredible team of health enforcers and health inspectors, Inspector Kesihatan, what we call them, who have done a very good job in doing contact tracing to look out for people who potentially may have the virus. So eventually, I imagine that with better resources, when the test kits become even cheaper, even more widely available, that we will start to do more swabs, more testing, even in the community which may have not any reported. Every now and then, we may turn up doing swabs. And Crystal, you may be interested to know that some countries have very innovative ways of identifying areas which potentially may have COVID.
That you're going to bring this up. Yeah, because I was going to bring up a question by Akus Comics. So this person said that, asked the question, are there any steps taken in neighboring countries that you wish Malaysia would implement? So I think it very nicely ties into what you were about to say.
I saw the question too from Aku, a good friend of mine. He's also he's a doctor who is now working in Singapore. So if we can compare what Singapore has done differently from Malaysia, I think I imagine what they have done differently is they have ramped up the number of swabs that they are doing over in their country as compared to Malaysia. In Malaysia, we do many swabs, we do thousands and thousands of swabs a day. In Singapore, they also do similar amounts. In what I would like is if in Malaysia we would have the ability to also do universal swabbing. Now this is very difficult because Malaysia is a large country, number one. It's a large country, and number two, not everybody is insured healthcare wise, because in Malaysia, healthcare is a universal thing. It is universal healthcare. You either as long as you're a Malaysian citizen, you are immediately entitled to free healthcare, basic free healthcare. So the testing for COVID is not cheap. The government is footing the bill for it. And if we were to do universal testing, it is going to be very hefty. It's going to be very costly. So earlier on, I was saying that hopefully when it becomes cheaper, it becomes more widely available, we will start to do more universal testing for everybody. That's a goal. So my hope is that maybe there are certain sectors in the private industry that can take up a more proactive, a more complementary role alongside with the government to help in this area. I think private healthcare has done a very good job too. They have been providing tests for patients at a nominal fee, at a nominal cost. Yeah. But what is nominal to most remains to be exorbitant to many.
Okay. Yeah, thanks for enlightening us about that. There has also been an interesting comment by PC1 who says that coronavirus wash their hands when they heard Joash is around. Yeah. Okay. So the other question that we wanted to ask you was that, so you know how coronavirus infects, or rather the people who succumb to this virus are mostly the elderly or the vulnerable.
Yep.
And those with underlying health conditions.
Yep.
However, there have also been many reports about the young and healthy, the young and perfectly healthy, in their 20s, in their 30s, actually succumbing to this virus as well. Yep. So are there a lot of these cases? How much of the percentage are these cases? Do these cases fall into?
Again, I have to be very honest with you. A huge disclaimer now. I think I should have disclaimed a bit earlier, right? But number one, I'm not an expert in the field. I don't dare to say that I'm a key opinion leader. I'm nowhere close to it. I'm just a very passionate, a very keen doctor who has helped in looking after patients with COVID. And more importantly, what I share is not necessarily 100% infallible, 100% factual, and certainly not representative of my employers or the Ministry of Health. But what I can say from the journals and the evidence available currently is that exactly like what you said, the majority of patients with the highest risk of succumbing remains to be those who are elderly, with those with what we call comorbidities. And the word comorbidities just refers to a general array of health conditions that a patient may have before they come to us, before they have it. So for example, diabetes mellitus, top of the list, patients with heart problems, also at risk, patients with blood pressure problems, patients who do not have great kidneys. These are patients who are at risk, and we spend a lot of time looking after them. We keep a closer eye on them to watch out for signs and symptoms of deterioration. Now, let's come to the point of patients who are young. Firstly, young patients remain to be at risk of getting infected. As a matter of fact, in the data, in the Chinese data, then the majority of patients who were infected were the young patients. Now, that's the first point. The second point is that even if they get infected, even if they succumb, they are the anomalies. They are not the common. So it is uncommon. I won't go so far to say rare, but it is very uncommon for young people to succumb to the virus. Partly because that the younger people, we have a better ability to withstand. Our body is just more robust. We have a better immune system. That's it. That's it. The problem with coronavirus, the problem with this infection is that not only does it affect the lungs, not only is it primarily a respiratory illness, it is also an illness which triggers what we call an immunological reaction. So I'd like you to think of, how do we put this way? I'd like you to think of the police and the army of a nation. Now, the role of the police and the army is to protect our citizens domestically and to protect our borders from foreign invaders. Now, let's say a foreign invader comes. Okay, let's say nation XYZ decides to invade Malaysia. Our police, our officers are going to start to protect us. They defend our borders, they chase away the invaders, they get rid of them, and that's it, done deal. Now, the problem with COVID is sometimes what happens is that the invaders come in, our police, our army gets mobilized, but not only does the army start to bomb and start to shoot at the invaders, but they accidentally bomb our own places, bomb our own homes. They start to shoot our own citizens. And this is what we call a cytokine response. A cytokine just refers to an overwhelming inflammatory response that inadvertently affects our other body organs. And this is when it becomes dangerous. This is when our patients deteriorate. Because not only does the body try to fight against the virus, it also triggers inflammation in other organs. And that is the problem. So I think the paper suggests that when these young patients deteriorate, that is one of the reasons why they deteriorate. Apart from those who have underlying health conditions, even if they're young, if they have underlying health conditions, they may be at risk. But another reason that we think is going on is related to this cytokine storm that is happening, an overwhelming immunological response.
Okay.
Does that make sense? Am I getting too technical?
No, I think that makes sense. Yeah, that makes sense. Thanks for explaining to us why, why young people are also affected by this, why some young people pass away due to coronavirus. Yeah, and the other question was, having have the experience of looking after patients and treating patients with COVID, at what point do patients start to show symptoms that indicate whether their condition is fatal or not?
Okay. So remember we were talking about how one of the most important aspects of my day looking after COVID is the examination. So things that tell us that things that start to sound the alarm bells at the back of our heads, like, okay, watch out, be careful, this patient, is that a few things. First and foremost is what the patient tells us. The patient tells us, hey, I'm having some difficulty breathing. Hey, my cough is getting worse. Hey, my fever is really bad. I'm actually really unwell. So what our patients tell us matters. And the second thing is that when we go in and we examine a patient, from experience and from looking after patients, the things that tell us that a patient is not doing well, it's not doing great, is that their oxygen level is starting to drop. The breathing starts to get rapid and shallow. They are not as alert, they are not as chirpy as they were when they first come. So not only is what we see at a point of time important, but the progression of how they have been doing up until that point is equally important. So that is the reason why we catch our patients early and we bring them to hospital to help us to have a gauge of how they have been doing all along. Do I need to escalate his care? Do I need to send him to EPO? Do I need to, or am I fine to look after him over here? So these are the things that we look out for.
Yeah.
Overseas.
Sorry, go on.
Overseas, just one last part, because I think there are some doctors in this audience that may be asking whether we do CT scans or other special blood tests. In my setting, we don't do CT scans for patients with COVID because it is costly. One is cost, and also two is that if we feel that a patient needs it, they probably should be already sent to EPO, and we should not delay their care, the access to their care. But what other countries, especially in China, they have done is that they have done lots of CT scans of the chest, which helps them to pick up the small minute changes in the lungs. And also very specialized blood tests, which I won't go into in this platform. But there are certain specialized blood tests that tell us that, hey, if this test is raised, keep a close eye on these patients. These are the things that have been done at advanced centers, not my center, but it is something that we are aware of.
Okay.
Sorry.
Okay. Yeah, that's helpful to know. Oh, no. Thanks for explaining. I think it's very helpful to know, how doctors and how nurses and how healthcare professionals kind of determine the severity of a particular case, right? So that you know what kind of next action to take as well. And for the rest of us not in the medical sector to kind of understand how severe is someone's condition. And I think, one of the hardest things and one of the most difficult things with having COVID-19 is that, with the virus being so infectious, in one's final days, they are not allowed to have family and friends by their bedside, right? Because of how infectious this virus is. So what is that like? Have you had experience with this sort of thing happening in your ward, or have you heard stories about this?
Fortunately, I have not had COVID-19 patients. COVID-19 patients who pass on and in my setting, yes, we have heard about these scenarios. It does happen, and it is always very heartbreaking. In my setting, there are patients. We have our some of my patients with a label called SARI, severe acute respiratory illness. Some of our patients who have this label, who have this label, are not allowed visitors either. And it has happened at times where some of them have done very, very poorly. Some of them have been very ill. And family members have asked, can I be with him? Can I hold his hand? Can I spend another? And unfortunately, we don't allow that because there is always that risk that even if it is not COVID, that the other bacteria or the other viruses may transmit. Or this is our patients while we are waiting for the COVID test to come back. And we just, as protocol, as a safety check in place, we do not allow visitors to visit if we are not certain of their COVID status. And yes, it is always heartbreaking. It is always heartbreaking. So what we have done in our position is that we have acted as proxies for a lot of these loved ones. That we go in and say, we wear our protection. We go in, we hold their hands. We tell them that, hey, somebody is here. Even if they may not be listening, even if they may be fully sedated, we still tell them. We still pass the message along that, oh, your loved one says hi. Your loved one says, I love you, etc. We have done that before. We have acted as proxies for some of these patients. It is never easy. We may have done this many times, but it is never easy.
Yeah, I can only imagine what you guys go through in that kind of setting where, you are kind of the intermediary person between the patient and their loved one, and both can't meet.
Yep.
Yeah, it's not easy. But in terms of when this pandemic gets better, and now that countries are emerging from lockdown and countries are slowly reopening, what kind of strategies do you think, or what can we as society do to continue to keep safe and amid countries reopening?
Yep. I think let's go small. As a person, I think there is nobody that could have said it better than Jacinda Ardern, the Prime Minister of New Zealand. And she said, the best way to go about is to assume that you have the virus. And that means that you are responsible, you practice social etiquette, you practice good distancing, you practice good hygiene. And if you're unwell, don't go out. So, and remember we were saying that now more than ever, but this should have been the practice even from before. Basic courtesy, basic decency. So to put it out there again, to nag again, I'm sure by now you would have realized I'm really, really naggy. And that's how my clinic consultation goes. Okay, so to put it out there again, hand hygiene. And you don't have to be obsessive about it, but just be reasonable about it. After you touch somebody's hand, after you have come in contact with another person, wash your hands with soap. Wash your hands. Or if you have the alcohol splash with your hands. If you have come back from work, if you have used a bathroom, if you have done some gardening, if you have used a computer, you have done the dishes, wash your hands. Simple.
Yeah, and they say the mobile phone is one of the most the device that you have to clean, because we go out and buy food, right? So I go to the hawker center and get my lunch or my dinner, and I give money.
Sit on the table.
My change, I put it in my bag, and then I hold my phone and I call. And then guess what? The phone is on your cheek, on your ear, on your
Don't forget where else you take your phone to. We take our phones to the bathroom. We take our phones everywhere, to the kitchen. So it's everywhere. So
what I do when I flew back from the UK, what I did was I bought a bottle of Dettol and I disinfected my phone, and I try to disinfect it once, in a while to just make sure.
I think that is a good move. That is a good idea. People have been asking. I'm sure somebody will ask. Somebody eventually, it's just a matter of time who they'll ask. What is the best form of disinfectant? Okay, so let's put the question out even before anyone asks it. The best form of disinfectant, people will say from a medical point of view remains to be the 70% ethanol, 70% of alcohol content. But for the lay person, the person out there, you don't have to purposely look for 70%. Anything which is soap-based would do the job enough. So literally any form of soap, as long as you see bubbles, that's it.
Bubbles is the key. I think you probably have drummed this into your practice very much. I think one of the comments we saw earlier was that when coronavirus sees Joash, they wash their hands. We do that. We make it a practice.
Do you have
a wash your hands sign at home?
No, because I think my father's a microbiologist. He used to serve at EPO-GH. So he's been the one that has been drumming it into us even. And even this whole practice about not wearing watches, not wearing rings. I mean, so it's just part of it. Bare below the elbow. Something that I learned in my time when I was a student in UK, and it's something I still do until now. Wash your hands, and that is a very big thing. Yeah.
Yeah. Thank you for reminding us about how something so simple can be so important and could be life-saving, right?
Agreed.
Joash, we just have 6 minutes left to go before Instagram will end the session. So I want to talk about anxiety. So you know how a lot of us have consumed news, like when coronavirus started about 4 months ago. I was one of those people that I Googled coronavirus Malaysia, coronavirus Singapore, or coronavirus UK once or twice a day to read the latest statistics, the latest cases, how many deaths, what symptoms, you know. And thankfully, I didn't get too anxious about it. For me, I wanted to know what was going on. But I know of people who were like, you know, I'm going to stop reading the news because overconsumption of news makes them anxious, and understandably so, because it's a very frightening, we are living in an unprecedented time.
Yes.
And so I have stopped giving them the news or rather transmitting the news because it worries them. So what advice do you have for people who get anxious? Should they stop reading the news so much, or how do they deal with anxiety?
I think you raise a very good concern over here, and I don't think this is just a problem of lay people. Even healthcare professionals, we also have anxiety, and the anxiety is different. We experience anxiety because of the fear of the disease, because maybe we know a little bit more. Whereas at the society level, anxiety could stem from so many reasons. I imagine that some people who may have lost loved ones from any form of diseases, be it corona or not, COVID or not, or some of them who personally have been affected by COVID, they have been quarantined, they have been placed on lockdown. And going back to the first point earlier on, as we mentioned, how some people have lost jobs, have lost their income, have not been able to put food on the table because of COVID. So the anxiety is very real. Let's first start by saying this, that anxiety is real. I think it's easy. I know of people who brush it off by saying, oh, you're thinking too much, don't read so much news, you know, get a grip of yourself. But no, because health is not just a physical aspect. I think this whole COVID thing, when we talk about COVID, everybody's talking about symptoms, signs, drugs, treatment. But we forget about the psychological well-being. We forget about the emotional well-being, the spiritual well-being. So anxiety falls under that. And if a person is too anxious, it manifests into a physical element manifestation that may not even be related to any actual organic diseases. Yeah. So with anxiety, the things that we tell a patient is to understand what is the source of the anxiety and to find the help that is there. So what are the help available from healthcare centers in Malaysia? In Malaysia, healthcare centers, we offer psychological services. We have a very robust psychiatry services. And I speak very high. I couldn't sing higher praises of my psychiatric team in Teluk Intan, where not only have they been providing very good, exceptional psychological and psychiatric input to our patients, but also to us as healthcare providers, where they call up, they bring us up and ask us, how are you doing? Talking to somebody makes a difference. Somebody in a position that can be able to help you analyze your fears, understand your anxiety, and to provide you with a backdoor. So coming back to the whole anxiety thing, get credible information, credible sources from reliable places, and more importantly, seek help. The way you would seek help if you are ill, the same way you should seek help if you are finding yourself drowning in psychological anxiety.
Yeah, thank you very much for I think anxiety is a real thing, and in very understandably so, again, that, you know, it worries a lot of us out there, because by reading all this news, we get like, oh my goodness, you know, it's something very real. It's like a ghost virus out there, and you know, reading deaths after death cases and stories.
And it's very sensational. It's very sensational. It's like, you know, pictures like you're saying that day, pictures of the Italian army putting people in coffins, the army coming in coffins, mass graves in New York. I think it's a sensational. These are the things that grab headlines. But why must these be grabbing headlines? Imagine if what grabs headlines is acts of kindness, acts of compassion. This sends an even better message than the number of death tolls, the number of things. So why not in our practice, for yourself as an influencer, which I think you've been doing incredibly, I'm putting this out to other influencers. Use your platform from a position of power, a position of influence. Use it to send out messages of compassion, messages of hope, to bring help to people who need, and offer yourself as a platform to help. And I think this is how we help make this world a better place. Literally.
Yes, very, very well said, Joash. Very well said. And and Anthony asked, have you explained why we should pray for Jill? We will tell Anthony that directly, but I'm afraid it's 60 seconds to go till Instagram ends this session, because Instagram allows a 60-minute window, and unfortunately we are right at the very end. However, Joash, I just want to summarize and wrap up. Firstly, thank you so much again for taking time out of your Sunday evening. I know it's your day off. Took time out to educate, enlighten, and you know, tell us and share with us your experiences treating COVID patients and what life is like in the COVID ward. And I think we took a lot away from what you've said, from everything to washing your hands, which is very important, playing our part, what we can do, what we can do to support you guys, which is to stay at home, to practice social distancing, to, you know, wear a mask, wash our hands. I shall remember that.
Please.
And also, you know, and really, and for sharing all your experiences with us today. Really, really appreciate it. And I hope everyone has enjoyed this session as well. So thank you very much, Joash.
Thanks for bearing with me. Stay safe, everyone.
Thank you for spending time with us. All right. Bye, guys.
Take care. All right.
Bye.